Welcome to our second video on Orofacial Myofunctional Disorders, or OMD. In this video, Stephanie will explain some strategies that we use to help resolve orofacial myofunctional disorders.
So one of the most common OMDs is a tongue thrust. It's a variation of OMDs, and this happens when the tongue lies too far forward or too far to the side. It just has inappropriate placement in the mouth, and this forward movement or lateral movement can occur during speech or swallowing. That's why we care about it. It's important to, seek service for a tongue thrust or an OMD because it will affect articulation and it will also affect swallowing. So a child might be receiving services for articulation when really that's just a symptom of the underlying problem. So they need to come and see us so that we can work on the tongue thrust. And after we resolve that, oftentimes the articulation just cleans up on its own and we don't need to target it at all. Some children receive some Orthodontia intervention as a result of the moving teeth from the tongue thrust, and they have gone through that, and then the Orthodontia comes off, but the tongue thrust was not resolved, so then those teeth go back to where they were before because the tongue is still exerting pressure on the teeth. So when a child comes to us to work on tongue thrusts, or if they have OMD things going on, we first look at breathing status. Where is the air coming out? Are they breathing through their mouth? Are they breathing through their nose? Is there a medical reason that they're breathing through their mouth? Do they have really enlarged tonsils or adenoids? Do they have some kind of anatomy, in their nasal structure that's making it difficult for them to breathe? Do they have some chronic, sinus issues, allergies, anything like that? We're not going to teach them to breathe through their nose if they're not able to do so effectively and efficiently. So we make referrals when we need to establish, appropriate breathing. And then once that is cleared up and we know that that's okay, then we start there. We want the air to be going through the nose. We want the lips to be together. We establish that oral rest posture. We want the tongue in the right spot, up on the roof of their mouth. We don't want it coming out between their teeth. Once that's established, we move on to some tone exercises. We don't want the tongue to just kind of lay there flat and in the wrong spot. We want it to be anchored to the top of their mouth. We want the lateral margins to be able to, move around like they need to. And then beyond that, we start working on some swallowing things and range of motion things. We want that tongue to be able to get to where it needs to go, and we want that swallow to be normalized. We don't want that tongue thrusting forward for the swallow. We want it to stay back behind the teeth. You swallow your spit thousands of times a day, and when that tongue is, pushing against your teeth, it's going to have some big impact on your dentition. So getting it back where it needs to be is important too.